Coming up next on Arizona Horizon, the latest on what could be the final attempt to keep the Phoenix Coyotes in Glendale. We'll hear from the Director of Access on how the state plans to implement Medicaid expansion, and we'll take a look at the changing nature of libraries. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. The city of Glendale is considering what could be the final offer to keep the Phoenix Coyotes playing hockey games at Jobbing.com Arena. Here with an update is Arizona Republic reporter Paul Giblin, who has been on this story. It feels like we've been on this story forever, Paul, but it does feel like something's about to happen here. Give us an update.
I think you're right. I think this week will be the week when we know whether the Coyotes will stay or whether they'll go. So I think it's going to break one way or the other. There's some important negotiations going on between the group that wants to buy the Coyotes. That's a group called Renaissance Sports and Entertainment, and the city. The crux of the deal here is that Renaissance wants to manage Jobbing.com Arena where the Coyotes play. The city wants someone else to manage the arena for them. And so the rub is, how much will the city pay Renaissance to do that?
Managing that arena has always been kind of the sticking point of previous negotiations. It sounds like, and correct me, when you were here last time we talked about this, the city has budgeted what, about $6 million for that?
About $6 million a year, correct.
Okay, so Renaissance comes in, and do we know what they're asking to manage the arena?
They're asking about $15 million. So that's obviously a gap between the $6 million and the 15. And so Renaissance has come up with the idea that they're going to slide a bunch of money back to the city that would equal that gap. So they would do things like ticket surcharges, parking fees, even naming rights from the arena. Theoretically, they'll resell the name. It won't be Jobbing.com Arena anymore. It'll be named something else. The city would get a piece of that, plus a standard lease.
Okay, now, from what I understand, that would again bridge that particular gap, and so you got revenue sharing and you got East Side kind of working their way in. But is that money guaranteed to Renaissance?
Good question. And now let's ask another question. Why would Renaissance be interested in giving all this money to the city? Why wouldn't they just keep the $6 million management fee the city's offering and keep all those revenues for themselves, right? That would be much smoother, be much easier, and wouldn't be all this money exchanging. So here's one possible answer, Ted. Let's suppose that Renaissance is going to borrow $85 million as part of their purchase price to buy the team from the NHL. And let's suppose that their lenders aren't very satisfied with all those speculative sources of money.
Yes.
The parking, the ticket surcharges, because that's dependent upon people actually filling up the arena. So let's suppose that the lenders want guaranteed money, like $15 million from the city of guaranteed money. That makes the lenders feel much better. But the city doesn't want to pay $15 million. So now Renaissance proposes giving all those revenue sources to the city, the speculative sources.
And indeed, and the city says, I would imagine the city would be a little hesitant to guarantee that money because all of a sudden the team stinks or something happens or whatever, and that money isn't coming in.
Right, and it begs the question, well, if these smart money lenders don't want to lend that money based on this speculative income, why should the city do it? What guarantees do the city get that these money lenders wouldn't get? The people are in the business of lending monies. So that very likely could have been the snag on Tuesday when there was an executive session meeting. So, speculating again, that if the city told Renaissance, firm up this deal, let's get some guarantees, Renaissance theoretically could have added a $1.50 additional surcharge to the surcharge they were already planning. They would put that aside, and then if these other revenues fall short, they would have that money, and then the city would tap into that, and that would get them back up.
So you're talking tributaries to the revenue streams.
Right,
yes.
Tributaries,
yeah,
right, or parallel streams or something like that.
A little geological thing there. These meetings, these were closed-door meetings? What's that all about? Well,
there's two types of meetings. There's your regular public meeting, which in Glendale, nothing gets done there. It's all done in executive session. These are the private meetings. In Glendale, when people are talking about how to spend taxpayer money, how to spend public money for public good, that usually gets done in private. And so they have these meetings, executive session, and they discuss it, and then when it's all done, and they're all winking and nodding and doing secret handshakes, then they trot it out to the public, and they say, voila, here's this story. Now, the Republic, I will tell you, has repeatedly asked for these proposals, for these numbers, and they repeatedly tell me, oh, it's in process. And I think what happens is they say, all right, the Republic wants this, so we have a checklist, so we're going to put about 90 names here. We have to circulate this about 90 different ways. And what a coincidence, just the day after we've all shaken hands, that's when the 90th person signs, and then we release it.
I see. All right, so it's secret, not so secret, but secret nonetheless. Now, apparently quite public is the fact that the NHL has to get an answer here reasonably soon. Give us a timeline of what's going to happen.
Well, it's hard to say, Ted, because the NHL is in the business, like all professional sports leagues, of threatening to move a franchise. If they don't get the deal they want, they say, well, there's Seattle. Seattle's very popular these days with both the NHL and the NBA as an alternative location. So they say, if we don't get the deal we want, we can move it to Seattle, we can move it to Kansas City, we can move it to Houston, we can move it to Quebec, something like that. So that's always a threat. It's hard to judge how real that is because all professional teams do that. But it is getting kind of close to the end. If they want to move a team in time to start next season, they would have to do that pretty quickly.
And wait, the NHL Board of Governors meeting the 27th or so. Then there's some other meeting July. Is there a drop dead anywhere in here?
Hard to say again. It's hard to say. This is what we do know. There is a meeting tomorrow on Friday, an executive session, in which the polished up deal from Renaissance, which theoretically could have a $1.50 extra surcharge on the tickets to make the deal good, is going before the City Council. The City Council is next scheduled to meet in public, a voting meeting, this coming Tuesday. So theoretically, they could vote on that. However, people have said they probably want to let it air out for about a week before they vote.
Is the NHL going to let things air out for about a week?
They seem to think that if they get enough reassurances, if they can sort of count the votes ahead of time, they might approve the deal on the 27th. Tentative that the City Council will do its part. And then the City Council, maybe early next month, will cement the deal.
And last question here, the city is still taking offers for running that arena, correct? Arena management offers are still coming in that have absolutely or probably nothing to do with the Coyotes?
Sort of. Four proposals came in from non-hockey management companies. Two of them got thrown away as not being realistic. So they have two that they're still debating. Or maybe they're not debating. Maybe they're really working with Renaissance, and these other ones are just kind of in their back pocket. They might come into play if the hockey team were to leave and you still want to manage that arena and put Bon Jovi and Taylor Swift or whomever in there.
Yes. So basically, if you want the mud bogs and all those circus on ice or whatever it is, that could still happen here. It's got to be a plan B.
That's probably plan B. It might not happen. I think there are plenty of members of the Glendale City Council who want a deal.
Yes.
They would like enough camouflage to hide behind it. It sounds like Renaissance might have provided enough camouflage for them.
Before you go real quickly, it sounded like, are they excited? Is the city excited? Is there a sense of urgency going on with this over there?
I think there is. I think the city is tired. They've been dealing with it for 4 years, fans as well. One other important part of this deal very likely will have parking fees, which Coyotes fans are not used to paying.
Yeah, well, get used to it, I would imagine.
I would imagine.
Paul, good stuff. We'll keep in contact with you. You keep us informed. Thanks, man.
All right, thank you.
Now the state lawmakers have approved expanding Arizona's Medicaid program. It's up to the Arizona Healthcare Cost Containment System to implement the new plan. Joining me now is Access Director Tom Becklock. And Tom, thank you so much for, holy mackerel, there's so much going on with this. It finally is a done deal. What does Medicaid expansion really do?
Well, it does a number of different things. So let's start with the most significant provision, which it's going to provide health care coverage for about 300,000 Arizonans, low-income Arizonans. So the major piece of that is restoring coverage for a population that we had to impose a freeze on 2 years ago as a result of the Great Recession and the budget cuts that the state were going through. So The first big piece is the restoration of that Prop 204. Prop 204 was an initiative passed back in 2000 to provide coverage for individuals up to 100% of the federal poverty limit.
All right, I want to get to money right now.
Sure.
The federal match for Arizona dollars, we're talking like $1.6 billion, something along those lines in the first year from the feds. Explain that. When does that start?
January 1st.
And how is it distributed?
It's distributed in that if somebody's eligible, then that person receives either 100% federal coverage, so the federal government will provide the state the funding for 100% of the cost for that individual if they're from 100% of the federal poverty limit to 133%. So that's roughly $11,500 for a single individual, up to $15,000. Or also the additional federal match that we'll receive is for a group that we used to cover called the childless adults in Prop 204, and our match goes from a traditional 2-to-1 match to almost a 9-to-1 match.
And is that the first year only or in succeeding years as well?
In succeeding years as well. So the group that's in the expansion group that gets 100% federal participation, that's going to phase down. So after 3 years, it starts phasing down towards 90% by 2020. And then the other group stays at about 90%. So that's a significant shift in terms of the federal government paying for a portion of the state's access program.
And the federal money, where does that before it gets to the person, where does it go beforehand? Access?
Yeah, what typically happens is Access will draw the money down. Access depends upon managed care plans or health plans that we contract with. We pay those health plans a set amount per month to provide the care to members, and so they'll have a membership and they'll take care of the membership and have providers and hospitals and doctors that they contract with. So it works through that system through managed care.
Okay. As far as the assessment on hospitals,
right.
When does that happen?
That will start January 1st. That helps pay for a portion of the state's costs, so the state does have some cost in restoring the coverage. So we will be working with our hospital partners over the next 6 months to sort of figure out what that final framework looks like and what the assessment looks like, and we'll have it in place for January 1st.
As for a general example here, Ted's Hospital, I've had trouble with emergency room visits and
right.
Uncompensated care. Who do I go to? How much do I get? How is that decided?
So what happens typically is somebody will show up. Now they'll require services. If they're uninsured, the hospital has to provide coverage according to federal law for that individual. Starting in January 1st, that individual will be able to enroll in the Access program. They'll select a plan, whether it's a United plan or an Aetna plan or some of the other plans that we have in our system. And then the plan will pay the hospital for the services rendered. We would hope that people aren't going to the emergency department at that point in time. Hopefully they're going to see their primary care physician and receiving services at the appropriate level. But that's how the funding flow works.
And just for a point of clarification, the assessment, that money is used to draw as leverage, if you will, for the federal money.
It is. Yeah.
Explain that again, please.
So what happens is we will make an assessment on hospitals. Hospitals are the single largest beneficiary of the coverage from a monetary perspective. So roughly about 50% of the funds that we spend for health care goes to hospitals. It's an assessment. They'll pay that money to Access. We will then use that money as part of the state's portion of the costs to participate in the Medicaid program.
What do we have as far as oversight of this money and this program?
Well, there is clearly legislative interest in this program. There'll be reports that we provide to the legislature in terms of how it's going. There's obviously a lot of interest from the hospital community, so we're going to have a transparent process with them in terms of sharing all of the information, a lot of stakeholder meetings. But clearly, moving forward, because of the legislative interest in this, I would anticipate that there'll be informational hearings and things like that in the future in terms of just looking at how this plays out.
And again, much of this does start January 1st.
Much of it does start January 1st.
Okay, and again, for a point of clarification, if I'm at 100% of the poverty level right now, what changes?
Well, what changes right now is if you do not have any dependent children, you're not eligible for the Access program because of the freeze. So starting January 1st, you will now be eligible for the Access system again. So that's the significant change that occurs.
133% of poverty level right now. What changes?
Right now, you're not eligible for the Access system. Starting January 1st, you are eligible for the access system.
As far as services, medical, dental, do they change? Are they the same, similar?
The benefit package remains to what it is now, that it does not include dental services, but all the other major medical services, prescription drugs, inpatient, outpatient, doctor services, physical therapy services like that, they're all included within the package. Behavioral health services, all part of the access package.
Assessment, you figure what, like 250 some odd million, something along those lines?
Yeah, it's we're going to start, the first year is state fiscal year 14 starting in January 1st, so that's midway through the fiscal year. We're going to see a significant increase in the access population. So we're not fully sure how quickly that population will present. So we are estimating about $75 million for the first 6 months of it, from January to July 1st. We're then going to reevaluate. The governor's budget that was presented to the legislature was predicated on an estimate of roughly $250 million in fiscal year 2015. But one of the things that we're going to tell the hospitals and other stakeholders is, you know, because of the flexibility that was provided for in the legislation, we're going to go ahead and set a rate for 6 months. We'll reestablish it, look and see what population and costs are after that, and then we'll reassess.
Will there be much of an informational campaign for those who are at 100 and 133% saying, by the way, here's what you need to know?
There will be information available at the majority of the applications are done at Department of Economic Security, our sister agency, and so there'll be information available there. We're moving to a new eligibility system in which roughly 40% of our applications come in online now. I think that's going to be a higher number in the future. And then, of course, I think that there will be a lot of challenges in terms of communicating to individuals not only the changes in the access program, but of course all the other changes in health care under the Affordable Care Act and the federally facilitated marketplace, and that's a whole nother show, but it's a lot of complexity in terms of the changes in the healthcare system leading up to January 1st.
It really is. There's so much information out there that needs to be sent out, and sometimes I think people are just holding up their hands and saying,
Sure.
I can't take. Last question. You talked about what's going to happen here at the first of the year. When will the state, be they hospital providers, be it the state itself, patients, tangible changes? When do you think the landscape really will change?
Well, I think what people don't necessarily appreciate is what an important policy this decision this was, that hospitals' uncompensated care had doubled, and that many hospitals were on the verge of really going through some challenging fiscal conditions. And so that was somewhat seamless to the public person, but this really helped stabilize that system. From what the public will see, it's that eligibility to the access program starting January 1st. That's the big change that's going to occur.
All right. Tom Betlock, good to have you here. Thanks for joining us.
Thank you very much.
Appreciate it.
Appreciate it.
Oh, excuse me. Things are changing at your local public library. The books are still there, but so are a variety of other amenities and services. We'll hear from a Tempe official about evolving libraries. But first, producer Christina Estes and videographer Scott Olson show us how Tempe's library is changing to meet the community's needs.
It's 10 o'clock on a Tuesday morning, and the entrance to the Tempe Public Library is packed.
We have families and children rushing in.
Open sesame!
Most head down the stairs for story time.
Peanut butter and jelly!
About 150 kids fill this room twice a week.
You're happy and you know it, wiggle your ears.
To wiggle, giggle, and read a little.
It's a heavy draw for families who are looking for something free and fun to do.
Parents also like the summer reading program where kids win prizes for finishing books.
And we're probably going to have like 200 families show up.
Librarian Sarah Kaufman wants her office to be attractive to everyone.
I think libraries have really worked towards being more welcoming and more inviting to the community, and realizing that the community has different needs.
Do you live in Maricopa County?
A concierge greets people at the front door, and a few steps away is the cafe.
There's ample seating where you can sit down and enjoy your snack, meet up with friends, read a book, relax. Great place to hang out and stay cool all summer.
Summer break brings plenty of young people to the teen center. Computers, comfy chairs, and even a video gaming club draws them in.
Teens can come and just hang out and socialize and play video games in groups or on their own.
Between all the computers, coffee meetings, and lively programs, you can still find plenty of books and one designated room where you'll be shushed for talking.
And here now to talk about the changing nature of local public libraries is Barbara Roberts, Deputy Director of Community Services in the Library and Cultural Services Division. That's quite the title there.
It is. It's way too long.
Well, welcome to the program. Good to have you here.
Thank you.
What is a public library?
A public library is the last great democratic bastion of society's hopes and dreams. That's the official version, but a public library is whatever the user needs it to be. They are evolving so that we address the actual real-life needs of people in their everyday lives.
Has the library's mission changed over the years, and if so, how?
If you think back maybe to when you were young, or even not so long ago, maybe 10 years ago, people still thought of libraries as warehouses. You went to the warehouse, you got some stuff, you checked it out, and you went home. Now, libraries are not so much a place to get things as a place to discover things. They've become active. Library has gone from being a noun to a verb. It's active, it's engaging, people discover, they learn, they connect. So it's quite the active place.
How much have computers changed this particular atmosphere?
Computers have changed the atmosphere in the library in that people expect to be able to have them there and use them. But the actual public library itself, inside, hasn't changed that much because of computers. However, the way people use libraries with computers has changed because they don't have to actually come to the bricks and mortar building. They can use their computer from home, and it would be as if they were in the library searching the collection. They can search for something at home, they can get it through a database, print it off at home, or they can search our catalog online, download a book to their computer or their mobile device, and check it out, and they're ready to go.
Does that mean that fewer people are going to libraries because those services are there right in the living room?
Libraries generally across the country have seen a gradual drop in people actually coming to the building because of those things. But in fact, the use of libraries and the services and the virtualness of what we do is increasing. So it's kind of a give and take.
We saw the kids singing and dancing, we saw story time and those sorts of things. Why at a library, and why is that important?
Oh, why at a library? Why not? A library is a place for children to know that they can go and be themselves and discover and enjoy and have fun, and that it's not a place that is going to tell them to be quiet, and they can discover that they like to sing. They can discover that being with mom or dad or their caregivers at a story time is a time of bonding, and all of that jumping around and all of that, believe it or not, actually addresses fine motor skills.
Oh,
For young children.
I just know that when I was a kid, if I went to the library and started singing and dancing, they'd show me the door. They'd say, little guy, go that direction. That's changed.
Yes, come on down again and relive it.
I'll start singing and dancing.
Yeah.
Teenagers on video games. Again, why the library, and why is that important? I would think you'd want maybe a little more engagement with the teenager.
Well, it's a hook.
Yeah.
It's a hook. They come in for that, and they stay and learn about other things. We do have a lot of video games that the kids play, but there are also kids who come in and, maybe they're tired of the computer, they push back, they look around, and they discover, oh my gosh, look at graphic novels. Look, DVDs. And they discover other things, and then they connect with other kids who've read a great book, and before you know it, they're reading.
It almost seems like libraries are becoming more like community centers.
They're becoming community engagement places. Community center sometimes has a connotation of perhaps some other types of services, but they definitely are community connection places. People connect with each other, they connect with information, they connect with the world. So they can be considered a community location, certainly.
With that in mind, the training for librarians, has that changed?
Well, the degree has not changed. To be a librarian, technically, you need to have a master's degree in library and information science. So that has not changed, but the curriculum leading up to that title has drastically changed. And as a matter of fact, there are some libraries that are requiring their librarians to have degrees in social work. They're requiring them to have degrees in business development. public service, and that's because the nature of the people we serve has changed over the years. It's not just those folks who want to read a book.
Yeah, it's the community right now.
It's the general public,
too.
very
Yeah.
diverse community.
Well, thank you so much for joining us and telling us more about our. We got to get down there and check that public
You
library
really
out.
do.
Thank you
Yes.
for joining us.
Thank you very much.
Friday on Arizona Horizon, it's the Journalists Roundtable. The U.S. Supreme Court strikes down part of Arizona's voter registration law, and opponents of Medicaid expansion gear up for a challenge by way of the initiative process. Those stories and more, Friday on the Journalists Roundtable. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.